In this special module, we are going to talk about the vaccines and the special situations. A lot of times you get questions on this. Alongside, we will also talk about the waste disposal mechanisms after immunization session and about the adverse events following immunization. So let's get rolling and let's talk about the first topic, immunization in disaster. In disaster situations, what are the immunization protocols that we need to give to the disaster responders or to the frontline workers? Please note that to the frontline workers, the immunization protocol is that mandatory. We need to give the tetanus toxoids and the hepatitis B vaccine. So that is for all the frontline workers, which include the army professionals or to the disaster response force or to the healthcare professionals. In the general population, if you talk, do we need to give any vaccine? Answer is no vaccine is required. But in disaster, during disaster, which is the most common, mind the words that I'm saying, which is the most common disease which happens in disaster? It is acute gastroenteritis. It is acute gastroenteritis, and because there is acute gastroenteritis, it may lead to malnutrition, and malnutrition will cause vitamin A deficiency, and that is the most common vitamin A deficiency, and vitamin A deficiency is associated with measles outbreak. So most common disease is always gastroenteritis, but most common vaccine preventable diseases, which is the most common vaccine preventable disease, beta. Now, if this is the question, which is the most common vaccine preventable disease, you have to understand that it is measles. So therefore, in disaster, it is always said that if the disaster is there, in case of disaster, you should always have a more than 85% measles coverage. You have to mandatory maintain a more than 85% measles coverage. Measles vaccine coverage should be more than 85%. And in case the vaccine coverage is less, or in case there might be children who are at risk, we can always have a supplementary round for improving the measles vaccine coverage. So improving the measles vaccine coverage, we might do supplementary rounds in case of disaster. So please note that which is the most common disease during disaster. It is acute gastroenteritis, which may lead to malnutrition, which may be associated with measles disease outbreak. Therefore, measles vaccine is one of the most important vaccine which comes to our mind when we talk about disasters. Please note, I would like to caution you, no cholera vaccine. Cholera vaccine is not given during disasters or during any phase, because cholera has a lot of healthy carriers. They have a lot of incubatory or the convalescent carriers, chronic carriers. So you have different carrier stages in cholera, and because you have different carrier stages, the vaccine does not have any sense, because the carrier stage will always be the force of infection who are going to spread cholera during the outbreaks. So that was regarding disaster. Point number 2 is regarding a child with diarrhea. So in case a child is having diarrhea currently, which vaccines is supposed to be given or not to be given? What do you think? Of course, we are not talking about the measles vaccine or the pneumococcal. They are all injectable. Common sense, I'm talking about the oral vaccines. So in case of a child with diarrhea, what do you do with the oral polio vaccine? Do you give it or not? Answer is, we are very small to stop an immunization schedule. Even to a child with diarrhea, we are supposed to give the OPV vaccine as per schedule. So we give the OPV vaccine as per schedule, but please mind it that this vaccine which you are giving to a child with diarrhea is taken as not counted. It is not counted, beta, and we need to repeat the OPV vaccine after 4 weeks or after the diarrhea is over. So please note that MCQ for you to understand. A child presents to you with diarrhea and he was also supposed to have the OPV immunization today. Will you give it? Answer is yes. We will not miss the opportunity to give the OPV vaccine. So we will give the OPV vaccine, but that vaccine will be unaccounted vaccine. It will not be counted, and then after 4 weeks we are going to repeat the OPV vaccine. That is what is the protocol for diarrhea. Talking about the next protocol for immunization in case of HIV. So in case of a child who is exposed, HIV born, child who is born to HIV positive mother. So in case a child exposed to HIV, please note that the mother was HIV positive. Now to this child who is born to a HIV positive mother. So we don't know whether the baby is HIV positive or not. I think you have done it in the NACO program. We talked about this, that when a child is born to a mother who already has HIV, so now the mummy having HIV, she gives delivery to a baby, and we don't know about the HIV status of this baby. Why? Because for 6 weeks we are not going to do any HIV testing. So would you like to give the vaccines for this time period, birth vaccine? Answer is yes, we are going to give all vaccines. All vaccines as per schedule will be given. In case the child is symptomatic, in case the infant or the neonate is symptomatic, please note that in case of live vaccines, if the child is symptomatic for HIV means there is significant weight loss, the child is having high grade fever, opportunistic infection, any HIV related cancers, things like these. So if the child is HIV symptomatic, or if the CD4 count is less than 200 cells, absolute CD4 count, or if the relative CD4 count is less than 15% of expected values, in these cases please note that the all live vaccines are contraindicated. Otherwise, in a normal, if you get a normal question that a child born to HIV positive mother, will we give the vaccines, yes or no? Answer is definitely we are going to give. But if the question says child is symptomatic or CD4 count less than this much, will you give? Answer is no. Live vaccines, killed vaccine can still be given. Talking about this rabies vaccine. Talking about especially about the rabies vaccine, please note that in rabies vaccine, whether the person is immunocompromised or whether the person is immunocompetent, rabies vaccine has no contraindication. No contraindication. Why? Because rabies is a 100% fatal disease. Point number one. Point number two. In case of a class 2 or a class 3 bites in animal bites in HIV positive, so that patient was already HIV positive and unfortunately that HIV positive person got an animal bite, and that animal bite was a big one. So let us say that we are talking of immunocompromised status in class 2 or in class 3 animal bite. You remember in rabies module we discussed about the classes of the animal bites. So if the bite was class 2 bite or a class 3 bite, in cases the person was immunocompromised, in case the person was immunocompromised or HIV positive and the CD4 count is low, in those cases please note that we always are going to give the rabies immunoglobulin. So what did I say, beta? That in case of HIV positive, symptomatic or CD4 is low, there is no significant number, there is no discrete number. If the person is HIV positive or symptomatic, or the person is having a low CD4, that is there is immunocompromised status, okay, immunocompromised status, in those cases we are going to give rabies immunoglobulin to both class 2 and class 3 bites. Also in these cases where the HIV positivity is there, in those cases you do not want to take any panga. Rabies is 100% fatal disease. You do not want to take any chance because the rabies is 100%. So therefore, please note that in these cases, the intradermal injection is not allowed. Instead of that, we give the intramuscular injection. So intradermal is not given, we give the intramuscular injection, which probably gives a better immunity for rabies vaccine in HIV. So rabies, the anti-rabies vaccine, you give intramuscular, and we give rabies immunoglobulin to both the class 3 and the class 2 bites. Talking about OPV, talking just a little bit about the OPV vaccine. Please note that the OPV vaccine is a live vaccine. It is to be given in caution with people with HIV. Why? Because there is a higher risk of vaccine associated paralytic polios. We have already talked on this a couple of times before, that in HIV we take a caution with the OPV vaccine. Talking about the next point, that is the point number 4. Next in line is point number 4, That is, what about the immunization in the rubella outbreak? See, in rubella outbreak, you're scared of what? Are you scared about the rubella infection in child? Of course not. We are not scared about the rubella in child. We are scared about the rubella in the mother. So that also, if the pregnant mother is there, if a pregnant female. So whenever there is rubella outbreak, there is a special vaccination strategy. There is a special vaccination strategy. What is the vaccination strategy? That is the only question you get. But whenever there is rubella outbreak, first of all, we have to vaccinate which all persons. Who is the person? It is the females who are in WRA age group. What do you mean WRA? Women of reproductive age group. So those are our prime targets now. Of course, common sense, who are non-pregnant. I don't need it to write it also, but it is for your general understanding. Of course, who are non-pregnant. You don't want to give a rubella vaccine. Rubella is what type? It is RA27/3 live vaccine, right? You don't want to give it to the pregnant females. So rubella vaccine is given to all non-pregnant WRA females at the first shot. Once these females are covered, the next in line is all children age 1 to 14 years. So all children age 1 to 14 years, they are our next target. And beyond that, we will think of giving to less than 1 year to 9 months of age, measles, rubella vaccines, and so on. So at the first level, we are more bothered with the mothers, with the pregnant females. So to save a rubella in the pregnant females, you need to vaccinate all non-pregnant females who are actually in the reproductive age group, who might become mothers. Usually it is said that if you have taken a rubella vaccine, the pregnancy should not happen. Pregnancy should be postponed for at least 3 months. It should be at least 3 months. Different guidelines are saying differently, but Government of India, we take at least 3 months. Next is point number 5. We are going to talk about the immunization for measles outbreak, or the SIA. SIA beta stands for the supplementary immunization activity. So primarily this supplementary immunization activity, it is more so in terms only of for the measles outbreak. So whenever there is measles outbreak, at that time we need to do an extra round of supplementary measles vaccination. Now this vaccine is given to all children. In measles supplementary round, it is given to all children age 9 months till 15 years of age. It is usually given to all children age group 9 months till 15 years. Plus, very important, it is also given as MCV 0 dose to 6 months to 9 months of age. So that means in case of measles outbreak, we even can decrease the criteria of age group for giving measles vaccine. So if you talk about the measles vaccine 0 dose, this measles vaccine 0 dose, it is nothing but the extra measles vaccine dose, which is given to children age 6 to 9 months of age. This is given during measles outbreak, or in people who are displaced or refugees, or like there is some political problem, some war is happening, or people are living in shelter homes where the chances of measles outbreak can happen. So in those cases, it is imperative for us to understand that we also give to children age less than 9 months. And this has been recently included in your Park textbook 26th edition as well, that the measles 0 dose is there for infants traveling to countries experiencing measles outbreak. So all said and done, it is primarily for children who might experience a measles outbreak. So that is what you need to know about the supplementary immunization activity, or the measles outbreak mechanism. I would also like to tell you over here that earlier we were giving only the measles vaccine. Then we started giving the measles rubella 1 vaccine. And then we launched the second dose of the measles vaccine called as the MR2 vaccine. So second dose was launched. How did we launch it? There is a mechanism. I had a brief discussion with you initially when we talked about the measles vaccine as well, that there is a mechanism to launch the second dose. So what we do is that we call it as a catch up, keep up, and follow up campaign. So please note, during the MR campaign, this is called as a measles rubella campaign. So what is the strategy that we use in a measles rubella campaign? The strategy that we use is called as a catch up, keep up, follow up campaign. In catch up rounds, you are going to give one dose of measles rubella vaccine to all children aged 9 months to 15 years of age. You give to everyone 9 months to 15 years the catch up campaign. So at least it definitely means what? There might be some people who already have taken the vaccine, so they'll get the second dose, and there might be some people who were unvaccinated, they get the first dose. So that means everybody at least got the first dose. And in the keep up, now you launch the new vaccine. So now you launch it as a mandate in the national immunization schedule that from now onwards, any child who is beyond 16 months of age, they will be eligible for the second dose. So I understand that for some years, there might be some people who will take the vaccine 3 times. But after that, there will be everybody who's taking the vaccine only 2 times. Are you getting it? So that is what is a catch up, keep up, follow up campaign. That in keep up, you will start the second dose of the measles rubella vaccine. And in follow up, we just continue what we are doing. You continue the second dose. You continue the second dose of the measles rubella. So primarily, this Empower campaign is to do what it is, to launch a new dose of the measles rubella vaccine. You just need to remember for your exam what is the catch up, keep up, follow up campaign. Please note it is for launching a new vaccine. So these were the things that you need to remember for the special situations in the vaccine. Next in line we have is the topic number 2, that is what is the waste disposal mechanism for the immunization. The first thing that will come to my mind is that how to dispose of the syringes or needles in a field immunization campaign or a camp. You are, let us say we all are medical officers and working in a CHC, PHC district hospital. We send our nurses to a field trip in some distant village to do the vaccination. Where will they dispose of the immunization waste? So try to understand that when a nurse or any immunizer will open the syringe packet, the outside plastic wrapper of the packet will be disposed of in which category? Please note it will be disposed of in a black category. The wrappers or the needle caps, they are not a biomedical waste. They will be disposed of in black category. What is this black category, beta? Black category is what is a general waste. So general waste will be the wrappers and the covers or needle caps. Okay. Next in line, you take the syringe, you break the ampule and you take out the vaccine and you inject to the child, and now your vaccine, the syringe is there. So what are you going to do with the syringe? Please note that the needle of the syringe will go into the needle hub cutter. So there is a hub cutter over there. Every immunization in the rural also, they'll have a needle cutter. So in the needle hub cutter, they will take this and you will just cut the needle from the syringe. So the syringe goes into which category? Please note that the syringe will go into the red category. So now you have a black category, you have a red category, and you have a white category waste. For white will contain what all things? White category. Please note from the immunization point of view, the white will contain, I'm talking of the rural setup. So the white category is going to contain what all thing? It will contain the broken vials of the ampules or the vials. It will also contain the needles. So now in the rural setup, what are we going to do? In the rural setup, now the needles and the sharps and the vials, please note the broken vials and the ampules, everything together, all the sharp and the vials, they will be disinfected in very important hypochlorite solution. Please mind it, I am talking about the rural areas where there is no facility for a common biomedical waste treatment facility is not there. So in areas where the common biomedical waste treatment facility is not available, that means the biomedical waste mechanism has to be done indigenously at the health facility level. So in those places, we are going to take the sharps, we are going to take the broken vials and put them in the white category and disinfect them with hypochlorite solution for 30 minutes. You disinfect them with hypochlorite solution for 30 minutes and then put them into a sharp pit. We have built a sharp pit. For details, you need to watch the biomedical waste management lecture. I've discussed a little bit more in detail what is a sharp pit. But anyways, sharp pits are always covered and you dispose of your needles and ampules, the broken glass vials into that sharp pit. So that sharp pit is there. What will you do to the red category? The red category, that is the plastic syringes. The plastic syringes you are going to again disinfect using the hypochlorite solution for 30 minutes, and then they are sent for recycling. Please note, there is no biomedical waste treatment facility. People are not going to take out the waste. So at a rural peripheral center, in the rural villages, in the tribal areas, forest areas, that is the only mechanism we have, and the covers will go off in the general waste, right? So this is what we do in a waste for immunization camp in the peripheral centers. If you're working in a big AIIMS level or tertiary level hospital, of course you will have the best of the best facilities, but I'm talking about the rural part of the India, which is 70% of the India. That was regarding the waste. Topic number 3 I would like to touch upon is regarding the AEFI, that is adverse events following immunization. That's again an important topic of discussion for us. The AEFI types can be asked in your exam. You can have broadly talking 5 general categories of the adverse events following immunization. We can talk about the product related, quality, immunization error, anxiety, or the coincidental. Very simple to understand. What do you mean by product related? That means that the AEFI stands for the adverse events following immunizations, right? So adverse event following immunization. Okay, so it is product related. That means the vaccine had the inherent property to cause that side effect. It was supposed to be there. This is the inherent property of the vaccine or the immunizing agent. That is the inherent property. What do you mean by the quality related? Quality related, that means there was some adverse event. This will happen in clusters. This will always happen in clusters. It is something which normally will not happen. So the batch of that vaccine or the manufacturing point of that vaccine had some contamination or some problem. This is related to a quality of vaccine defect. It is a defect in the quality of the vaccine, defect. So basically, again, this is not in me and you point, this is from the manufacturer point. So it will occur in clusters. That is point for us to understand that usually when there is any 2 or 3 AEFIs reported from a single area, you have to stop using that vaccine. Why? Because, and you have to report it to the senior, then there will be a AEFI investigation which is going to happen in that area. So the quality related is regarding the bad quality or manufacturing defect of that vaccine. Coming to what is the most important MCQ which is asked in your exam, that is regarding the immunization errors. What do you mean by the immunization errors, beta? Immunization errors, these are also known as the program errors. Immunization, these are called as the program errors. So basically it is a program error. It is our error. Our ANM female or the nurses or the Anganwadi workers, not the Anganwadi of course, ANMs or the nurses or the doctors even, they did not know how to give the vaccine. You gave an intramuscular vaccine using intradermal, or you gave intradermal vaccine using intramuscular route or whatever. Some problem happened. So it is a problem with the immunizers. It is a problem with the immunizers. There could be non-steroid. I'll use a separate page for the immunization errors. The types of immunization errors could be using non-sterile methods. That means the training was not appropriate. It can also be using alternate route, which is one of the blunders that many nurses would do, or doctors even would do, or any healthcare professional, without to name anyone. So immunization errors could be using alternate route of vaccination, or inappropriate use of the route of the vaccination, which is not as per the protocols. There could be any abscess or infection of injection site. There could be some toxic shock syndrome because the expired vaccines or the contaminated vaccines, they were by chance used in the program. So these all amount to the immunization error, and they are very serious error. We do not take them at all lightly. So these are what are the types of the immunization error. These are important from the program perspective, because this talks about the standard of the or the quality of the immunization program that we have in India. It talks about the quality of immunization program in India. Next is anxiety related. Every injection has to be anxiety related. My daughter, when she went for the Covishield injections, so of course there was anxiety and she got a lot of pain on her arm, just not because of COVID vaccine. It was probably because of anxiety related. So anxiety related are not related to any specific vaccine. They are in general for any vaccine. So not related to a specific vaccine. These are not related to the specific vaccine. That is what is anxiety related. And coincidental is that you took a vaccine and next day it rained. So it's coincidence, right? So coincidental is that when the adverse effect was not related to point number 1, 2, 3 or 4. So it is just by chance. It is just by chance. So as far as the side effects are concerned, in the previous module, when we talked about the national immunization schedule, we already talked about major side effects. Just to have a little bit more in-depth understanding about the side effects for BCG vaccine, first of all, the most common side effect that we have is a scar formation, or we can have fever. With BCG, we can also have suppurative lymphadenitis, which can actually happen after more than 1 month of taking the vaccine also. Next in line is talking about the oral polio vaccine, beta. If we talk about the oral polio vaccine, the child may land up in VAPS. What is VAP? VAP stands for Vaccine Associated Paralytic Polio. It stands for Vaccine Associated Paralytic Polio. The VAPs can be of two types. We can have a contact VAP, or we can have a recipient VAP. What is a recipient VAP? In that, the person, the child, tells that I have got paralysis, and this child says that before 4 to 40 days, the child had taken the OPV vaccine. So that is called as a recipient. He was a recipient of the OPV vaccine. So within 4 to 40 days, if a child had taken oral polio vaccine, 4 to 40 days of onset of paralysis, before 4 to 40 days, if the child had taken OPV vaccine, that is called as a recipient VAP. What do you mean by a contact VAP? Contact VAP is basically a child. This child got paralysis. He says that, I asked him that, did you take OPV? He says, no, I didn't take. But my friend, my brother, he took OPV. So he is basically a contact of a person who took OPV vaccine. Are you getting it? So that is what is called as a contact VAP. Please mind it, recipient VAP is the person who got paralysis and he took vaccine. Contact VAP is a person who got paralysis and he did not take vaccine, but his contact had taken vaccine. That is what is contact VAP. So contact VAP is a VAP that is, he is in contact with a person, with a child who received vaccine. And he was in contact with the child within 4 to 75 days of having the onset of paralysis. So that is what we mean by the vaccine associated paralytic polios for oral polio vaccines. Talking a little bit about hepatitis B, nothing very special about hepatitis B. The most common side effect is anaphylaxis. As far as pertussis vaccine is concerned, if we talk about the pertussis vaccine, please note that the pertussis vaccine, the side effect we already talked is unconsolable cry, but alongside unconsolable cry, another side effect is progression of the neurological disease, or there could be neurological deficits. There could be neurological deficits, or there could be encephalopathy. And that's where the understanding of the AEFI types is very important. See, there is something called as coincidental and product-related effects. The product-related is that every type of pertussis vaccine is supposed to cause some encephalopathy. So there is, I think you must have heard about this Dravet syndrome. So what is a Dravet syndrome? Dravet syndrome. It is a myoclonic epilepsy of infancy. It has been shown that this Dravet syndrome is not after any vaccine. But usually it is linked with this vaccine. Why? Because it is more commonly in the later part of the infancy. So people or children will come and say that I took this vaccine maybe couple of weeks or couple of months ago. So it is associated with this vaccine. Whether the vaccine causes Dravet syndrome or not, that is definitely a question of more research. Dravet syndrome is, I think many of you must already be knowing, it's a genetic disease, right? You have the SCN1A gene defect. It is in this gene defect. So that's what is understanding, that whether this disease, is it product related or is it pure coincidental, we have to understand. In Dravet also there is myoclonic epilepsy, right? It's an epilepsy of the infancy. So people have linked it with encephalopathy, but as such, research does not say that the pertussis vaccine is going to cause this type of disease. But yes, people with some neurological deficit, they may land up into severe neurological deficits. Pertussis vaccine is also known to cause hypotonias. In fact, that hypotonia is the most common neurological defect. Most common neurological defect in pertussis vaccine is hypotonia. However, the most common side effect is always unconsolable cry. In case of the BCG, in case of the tetanus toxoid vaccine, please note that we already talked that there could be brachial neuritis. Now this brachial neuritis is again that same problem. It can land up in more than 1 week till few months. So even few months after taking a tetanus vaccine, people may land up in brachial neuritis. And the brachial neuritis is kind of okay, 5 to 10 cases per million injections is what is the incidence of this brachial neuritis, right? So with that, you have talked about most common AEFIs, but for your exam, please note that these are the AEFIs or the side effects you need to remember for your most commonly asked questions. Talking about the AEFI time of reporting, that's also again one of a very high yield MCQs which can come in your exam, and of course for all the students who are appearing for the UG exam, this is definitely important. So within 24 to 48 hours, any acute hypersensitivity reactions, inconsolable screaming or the cries or the anaphylaxis has to be reported. Within 7 days, local reaction, sepsis, injection sites, abscess has to be reported. Within 14 days, any case of seizures, encephalopathies or neurological disease, neurological deficits have to be reported. And within 3 months, the brachial neuritis, acute flaccid paralysis, thrombocytopenias, intersusception from the rotavirus vaccine has to be reported. And within 1 year, lymphadenitis or osteitis, specifically talking from the BCG vaccine point of view, should be reported. So that's what you need to remember for the adverse events following immunization. Thank you so much for watching this whole module on immunization. See you in the next chapter next time.
Hi guys, please subscribe my channels.